Clayton, can you give me screen sharing permission, please? Good morning, everyone. Looks like we might still have 1 to 2 people getting in, so we'll give it just an extra minute this time since this is new. All right, can you all see the slides? Great. All right. Well, good morning. For those of you I do not know, my name is Megan Cluth, and I am with KUC-PPR, and I'm excited to be facilitating this group. Thank you so much for being part of the Family Partnership Group. We're really excited to get started. So the plan for today is to just do a quick welcome, a few introductions, and then kind of talk a little bit about some ongoing work that's happening in terms of family partnership to provide a little context and opportunity for coordination and complementary work. And then we're going to get into a pretty interactive discussion that will probably continue. We'll see how far we get today, but may continue in our next session. So before we get too far into that, again, I'm Megan Cluth. I'll be your facilitator. I'm very excited to say that Heather Smith and Cora Ungerer from KDHE will also be joining us in this group. I know you just heard from Heather, and they both are very heavily involved in family partnership at the statewide level through the Family Advisory Council. And so we'll talk a little bit about that, but I so appreciate them being part of this and sharing kind of their expertise, and also being here to listen and hear from what you all hear about family partnership in your work. So with that, and I think all of you have had at least a little opportunity to meet each other, but if anybody has not, let me know and we can do quick introductions.
I wouldn't mind doing introductions. I don't know that I am familiar with everyone on here.
Absolutely. Yeah, if people want to just, I can kind of pick names if you don't mind, and just do a quick who you are and where you are from, and maybe why you picked this group. Do you mind kicking us off?
I do not. I'm updating my name, Crystal Henry, with the Family Conservancy. You know, really, in my program, I could have been a part of any of the work groups because they basically outline all the facets of Start Young, which is based in Wyandotte County and is aimed at increasing access to quality childcare. So right now, we really need to figure out the teacher situation so we can keep our childcares open. But a big part of our work is directly engaging with families, providing tuition scholarships, and learning about what their needs are. So my secondary role on the recommendations panel is as a parent. So I have a 10 or just turned 11-month-old and a 4-year-old in early childhood programs in Wyandotte County. So
thank you.
Yeah.
Right. Esther, you are next on my screen.
Okay, I'm Esther Kotwitz. I'm the early childhood coordinator for Lawrence Public Schools. And I was interested in this group because we are always looking for new ways to build partnerships with families, especially families of children with low incidence exceptionalities. And it's sometimes a challenge because everybody's so busy to do that. So I thought this would be a good group for me. Thank you.
Thank you. Gail?
Hi, I'm Gail Kozad. I'm with Kansas Children's Service League. I chose this one just because so much of the work that we do is really about partnering with parents and connecting them with, from a long-term standpoint, many of the parents that we are involved with don't have positive peers. They don't have someone to turn to. And so our goal is to connect them with people that become positive influences in their life and are going through similar things, and they can support each other. So this is important to all the work that we do at KCSL.
Thank you. Natalie?
Good morning. I'm Natalie McLean with KSDE. I joined this group. I'm doing some work across different age groups, actually. It's like pre-K all the way up through graduation on family and community partnerships. And I feel like early childhood's got it going on, but I feel like we also need to remind school districts in particular that family partnership is just not schools giving parents information, but really partnering with those parents and finding the best way to help those kids succeed. So I'm excited to be with this group.
Thank you. All right. Is it Dana? Is that correct?
Yes. I'm Dana Schott. I live in Ashland, but I actually work for Russell Child Development Center. We have offices, our main office is in Garden City, but we have an office in Dodge, and that's where I office out of. I am an ABC, which is the attachment and biobehavioral coach, both infant and toddler, and I also do triple P. And I chose this because, being an attachment coach, I know that parents and families are their child's first and most important teacher. And so I think in order for us to, have a better future for our state, we have to reach out to these families and make sure they're getting their children off to the right start. So that's why I chose this group.
Shelley?
Here we go. I'm Shelley Cromie. I am a student support coordinator for Communities and Schools of Mid-America, and I work out of Marysville Junior Senior High School. I have a background with Head Start, and I'm also a board member with Pony Express Partnership for Children here, and also a mother of 4. And a big part of my job in all aspects of that is family engagement. So, yeah.
Thank you. All right. Is it Maritas?
Yes, good morning. My name is Marita Saltuna. I am the director of the Kansas Deafblind Project. And I chose this work group because one of our objective is family. One of the goals of the grant is family engagement. As you may know, combined hearing and vision loss is the lowest of low incidence disability. And sometimes our families are the only ones out there in their county that have a child with deafblindness. So we work very heavily with our families on networking and opportunities.
Great, thank you. And then Lisa.
My name's Lisa Schmidt. I'm the Executive Director of the Women's Community Y. I was assigned the family work group, I think, because I have a strong connection to families serving in our community. And someone made the comment that parents are their first teachers, and I do totally agree with that. But family connections and relationships are the most important piece in early learning as a director of a center. And those connections, how do we connect with those parents?
Thank you.
In the avenues that are available.
All right. Heather and Cora, do you want to say a quick hello?
Sure. Hi, I'm Heather Smith. Like I said earlier in the session, I'm the System of Support Section Director. So in addition to the Family and Consumer Partnership work that I oversee in our Bureau, I also oversee our Screening and Surveillance Unit for newborn screening and birth defect surveillance. And then I also serve as our Title V Block Grant Coordinator. So I'm kind of wearing different hats, but my main priority for this group and being involved in, and again, thank you for letting me join, even though I'm not technically a panel member. But we are working with the Family Leadership Team, which is part of the Early Childhood Governance Structure, with our Family Advisory Council. Our Family Advisory Council, Title V, is working through the Family Leadership Team to create a family engagement toolkit. And so that's, I think, what Megan will give all of the context of that, I'm sure, much more articulately than I just did. But that's my main interest, is trying to be a value added to support the development of that toolkit, and in partnership with families and our professionals and partners through the panel.
Excellent.
And I guess I'll go last. Hi, I'm Cora Unger. I am the Family and Consumer Partnership Program Coordinator, which is a newer role at KDHE, where my position works very closely with our Family Advisory Council, getting our meetings set up, keeping in contact with their families, and then as well as working as the network administrator for the Supporting You network, and getting that moving and going. On a personal note, I have 3 kids, an 11-year-old, a 5-year-old who just started kindergarten, and a 2.5-year-old. So life is busy, and it's nice to have all the perspectives as well.
Thank you all. Did we miss anybody? And we also have Clayton Gerard here from CPPR as well, who will be helping us with any Zoom issues. So thank you, Clayton. All right. Well, thank you. I'm glad we took a few minutes to do that. I think there is a wealth of knowledge, both professionally and personally, in this group that will be really beneficial as we kind of all bring, I think all of us probably wear several hats in the different aspects of our lives. And I think that's helpful in any group, but I think particularly when thinking about family, even more helpful. So thanks for sharing a little bit about yourself. So with that, is anybody willing to take notes today and or do a brief report out? When we come back to the group, we'll be in this group until about 11, and then we'll come back to the full panel, and each work group every month we'll do about a 5-minute report out of just kind of an overview of what was discussed. Is anybody willing to volunteer for that today? Either one?
I am not the best note taker, but I'd be happy to report out for the group.
Thank you, Crystal. Much appreciated.
I can take notes if somebody else wants to report out.
Thanks so much, Natalie. We appreciate that. All right, we've got that all set. And then I know it was in the email and it will be in the follow-up materials as well. But there will be an opportunity if anybody's interested in being a note taker moving forward, as well as being a chair, which is basically pretty minimal work, but working a little bit with me, Heather and Cora, just to kind of make sure we've got the agenda set for the upcoming meeting. There might be a little bit of communication between meetings, but pretty minimal. So if you're interested in that, you do not need to let us know today. You've got some time to think about it. we ask that you email Debbie Deere by August 31st. And again, there will be a little bit more information in the follow-up as well. So with that, let's dig in a little bit. So before we start the discussion, I wanted to provide a little context in terms of A, why family partnership was identified as a group, and then B, a little taste of some of the things happening in terms of the All In for Kansas Kids strategic plan and PDG. We're really thinking about how all of these groups can coordinate with ongoing efforts and that they can be complementary. There is so much work to go around. And so just to provide a little context, I know Heather mentioned a bit of this. So this may be familiar to some and this may be fairly new to others. So stop if you have any questions for us to go through. I'll probably go through this fairly quickly just so we can get into our discussion. So we all know that family partnership is a critical part of the preschool development grant and the All In for Kansas Kids strategic plan. It is a common theme throughout much of our work. And I will say what you're going to hear about today is like one specific area or a few specific areas going on at the state level. There are many efforts going on locally, regionally, and across the state, and many of you are involved in them. So certainly do not want to imply that this is, the only thing happening. I think it's just kind of how it ties into the governance structure and the strategic plan. So as you see here, this Kansas Family Leadership Team, which we'll talk about in just a minute, is part of our early childhood governance structure. And so there is an opportunity that we see to coordinate a bit with that group, as well as potentially with the Family Advisory Council. And as Heather mentioned, she and Cora lead the Family Advisory Council, which is driven by the Title V State Action Plan. And Heather and I got together several months ago and just realized, oh, there's a really great opportunity to kind of make sure we're coordinating between that plan and the All In for Kansas Kids strategic plan, because family engagement and partnership is just a strong theme throughout. So obviously each of those plans have slightly different focus areas, but certainly far more overlap than not. And so we just wanted to point out on this governance structure that there's the family leadership team. We'll talk again in a minute about who is part of that, but that there is also a lot of collaboration with Family Advisory Council, and that both of those groups are resources for this group and kind of opportunities to make sure that we're just staying coordinated across the system. So the Family Leadership Team started this summer. It's a new group, and it's a collaborative group of family leaders from the Family Advisory Council, which is in the midst of an expansion, and the Family First Advisory Council, which also launched this summer, so it's been a busy summer, as well as representatives from the key early childhood state agencies. And so the goal is to, in a very collaborative way with both family representatives and agency representatives, work together. They meet quarterly, and they are supporting the implementation of a coordinated statewide family partnership strategy guide, which I'll tell you more about in a minute. Any questions at this point? Great. Okay, so, and we can share the strategy guide in the follow-up as well if anybody's interested in reviewing it in more detail, but wanted to share a little bit about some of the things that have happened to date, as well as some of the things that are being thought about. This is very much a living document. And certainly I think this group will be a very helpful resource in thinking about where are there gaps across the system in terms of family partnership? What are you seeing in your roles? We absolutely encourage you to bring things that you're seeing either that are like system-wide or in certain parts of the state to help inform thinking about this really at the statewide level. So the strategy guide was developed collaboratively by KUCPPR, KDHE, and the Kansas Children's Cabinet and Trust Fund at the beginning of this year. Again, it's a living document. It'll probably be updated as we learn more. It's to cover the lifespan of PDG as well as the strategic plan. So it will likely evolve. And there's really three primary goals. First is increased alignment across state agencies, and then ensuring family voice throughout our system, and then evaluating and increasing representation and equity. So I'm going to go through a few of the strategies that are being looked at in terms of how to actually achieve those. Again, this is going to be fairly quick, but stop me if you have any questions. And again, this is not in any way to imply this is like the end all be all of all the solutions. I think there are plenty of opportunities for discussion as well as revision. So in terms of increased alignment and commitment to family engagement among state agencies, and again, this is really where the family leadership team is coming in to provide some support to help implement this and provide feedback on this. But looking at things like, are there opportunities to look at like how consistent stipends are in terms of when families participate in different groups across agencies? Is there common language? Is there an understanding of what different agencies offer for family partnership opportunities? So we're looking at like a directory, like a calendar, or something like that in terms of like what types of groups or events exist. And then where are there just more opportunities for agencies to collaborate, recognizing this is something that is part of all of our work. And so how can we make sure we're supporting each other? The family partnership it's difficult. It's a hard thing to do. Heather talked about the toolkit, which we'll get into in a minute. And that's the point, is to encourage conversation about how can we all continue to learn from each other and do this better and share some resources. So that's one goal. We'll talk about the toolkit here in just a minute, but that is very much a product that is going to come out of this. Also looking at some other like standards of quality. There are so many national frameworks and tools and trainings available, and just thinking about how can we position Kansas in the best way possible as we think about family partnership. We've also talked about having some sort of like cooperative commitment statement or language across agencies, just really all using common language to say that we all in Kansas believe in family voice and ensuring it throughout all phases of our work and all levels of our work. So some of this is still very much in the works, but that's the general idea. And then lastly, thinking about how families actually access information and looking at both existing tools and like how we could potentially modify them or build upon them, but just making sure that there are opportunities for families consistently, but also that there are ways that families can easily access that information, and how might we be able to address any gaps in that. Okay. Heather, do you mind talking a little bit about the toolkit?
Sure, if I could find my unmute button. Okay, so I think ultimately the crux of it was we have in our Title V plan, we have a priority focused on family supports and services. And one of our objectives was to try to create this kind of toolkit that could help our local grantees better engage families. What we hear from some of our grantees when we say, well, what are you doing around family engagement? They're like, we do a survey. Okay, I mean, surveys are great, don't get me wrong, but surveys aren't necessarily that active engagement with families really being at the table for lots of conversation. And so we kind of had conversations with our partners and said, what would be valuable? And it sounded like realistic tips, tricks, real life examples of different ways to engage families at different levels. Another kind of framework that we use within Title V, Maternal Child Health Services, is a levels of engagement framework that's given to us by our national association, the Association of Maternal Child Health Programs. And that basically states that there's 4 different levels of engagement. There's the level where you're basically getting input, which is like your basic surveys. Then there's a level of engagement where you're really connecting with families to hear their particular, very specific, you're having like focus groups or having advisory groups that are focused on a very specific part of the population. A lot of times this happens with like special healthcare needs, and we're talking about like, okay, a disability specific group. And then there's a level of engagement where you have families representing advisory roles from a systems perspective. That's how we view our Family Advisory Council. But then there's that next layer of engagement where you're engaging families as strong partners, policy leaders, and really engaging them in all of the work that you're doing. And so those are kind of how we strive to engage families at all those levels, meeting families where they are. And so what we identified is with our partners, a lot of our partners saw engagement as that basic input level. And when we'd say, well, how could you engage them in other ways? there'd be like, well, I don't know, how would we do that? So we thought, let's put together this kind of like real life toolkit of things that could be valuable to help them spark conversations, think about how they could really engage families in different ways. And then the All In for Kansas Kids plan came, and Megan and I connected and said, oh my gosh, wouldn't this be great to have more systems wide and not just have Title V doing this for our grantees, but really partnering together to create something across our agencies that could help, because there was such a strong focus on family engagement in the All In for Kansas Kids work. So that's kind of where this came to be. Our toolkit, we have a really, really high level draft outline of it, mainly thinking about like how, like ways to form advisory committees, or how do you connect with families? How do you show your support and commitment to family engagement as an organization, things like that. But that none of that is set in stone. So I don't want to, hone in on that too much, because that was just our brainstorming way back when. This group and our Family Advisory Council with the family leadership team, we're hoping that the input we can get from all of you guys will help us really see a clear way to kind of organize the toolkit. What tools might we need? Who has stuff already? But we see this not as a this is how you must do kind of toolkit or guidance, but more of a here are frameworks for you to build from, ways for you to make this your own, recognizing that we can't have one system or one way to do it across all of our systems and programs, because all of us are so different, and we need that, and families are different. So how we connect for our populations won't work for maybe somebody else. So anyway, that's my thing, and I'll stop talking because I'll end up talking forever about it. And Megan will have to shut me up.
Heather has no lack of passion for this issue, as you might tell. Marita, just
I do not.
Looks like we have a hands raised. Go ahead.
This is Maritas. I have a question, Heather. So the toolkit, is this for practitioners as a guide when we are working with our families?
Yeah, for professionals who are trying to engage families in their work. Now that said, our Family Advisory Council also has put out there and said, well, wouldn't it be awesome if we had kind of a similar toolkit for our families on how they can engage to help them better prepare to engage with partners. So we definitely love that idea. That wasn't, again, when our plan was created, it was about getting our partners to get families to the table more frequently. So that was our focus, but the Family Council very quickly said, yeah, but you're still missing part of it. And you're like, you're right. And we need to build that too. So how do we do both and do all? Like, I want it all, but that's just my passion speaking. So I am often also told, Heather, you can't do it all at once. So this is where we're starting. But I want to be part of the other conversations too, if they happen. Maybe phase 2.
Maybe. So we have some questions today. We are going to stop talking because the point of this work group is we want to hear from you. And we wanted to give a little context to some of the work that's happened over the course of this year, and certainly the foundation that KDHE and many of your organizations have laid across the state over the past many years that we think we can build upon. But we also want to hear from you. You all have a huge amount of expertise to bring to this group, and whether it's things that are going really well in terms of family partnership from where you sit as a parent, as a family member, as a professional, whatever hat that might be, and things that you feel like could be improved or ideas you have, like this is the space. So there are plenty of opportunities to tap into the work that's going on, but we very much want this, the focus areas of this group to be led by you. And so we have a series of questions, and Heather and her team did this exercise with the Family Advisory Council in July, and it was really interesting to hear the conversations and hear what people had to say. And it's a series of questions basically about what does family partnership mean? Like what, there's some kind of specifics about what it could look like from a family experience. So I ask you today as we go through these questions to think about it both from your professional standpoint, but I think also, we all have been engaged in some way, good or bad, in our lives, whether it's professionally or personally or like whatever. And just think about like what have you liked? What have you not liked? I think at the end of the day, like we're all people. And so just kind of thinking about how can we take all of our experiences and apply to how we are thinking about family partnership across the state. So we will take, well, Natalie will very kindly take notes, but we will take these notes and kind of take them also with the Family Advisory Council, and that will be very helpful to share with our family leadership team meeting coming up shortly to think about this toolkit and some of this other work. We really want to use the feedback gathered to kind of help inform that. But also my hope is that it might help bring us up some conversation today and potentially if we continue in September about where is this group going to go next. Does that sound good for the rest of our time? We've got 23 minutes. Okay.
Megan, can you just,
oh, go ahead.
yeah, sorry. Can you say again who convenes the family leadership team? I missed that.
Yes, absolutely. So it's, I actually facilitate that as well. So CPPR is involved, but it's very much collaborative. There's a representative from DCF, KDHE, KSDE and KPERC, and the Children's Cabinet. And then it's made up of representatives from the Family Advisory Council, so family leaders, and then the new Family First Family Council, which is focused on child welfare.
Thanks.
Any other questions? Anything else people want to bring to the group as well? Okay. Is it helpful to keep the slides up during the questions, or would people prefer to just kind of be able to have more of a casual conversation?
Personally, I like the slides up. It keeps me focused.
Okay. Okay. Perfect. That's the easiest answer. So great. If anybody has another preference, we can always switch back and forth. So again, there's 4 topics today. We will just kind of see how far we get and can continue in September. The first topic is collecting input from families. And these are some guiding questions, but feel free to interpret this however you would like.
We just did a survey to our families. We partner with 14 childcare centers. And so we, because of the pandemic, really were mostly just able to offer it online, although we gave our center directors the option of printing it and we could collect them. That was difficult because it put a lot of onus on directors, and we don't like to do that generally. Our initial plan was to bring our staff on site with iPads, and you could have that incentive gift card on site, and that's how we wanted to do it. But we were pretty surprised at just how many responses we had and the diversity and representation within those families. So pleasantly surprised and gathered a lot of great quantitative and qualitative feedback on how they viewed our services, and also just sharing about a little bit about their family situations.
This is Marita's. This is collecting input from families is challenging for us. What we do, we're getting ready to rewrite our grant. It's a 5-year grant, and we do a family needs assessment survey. We have about 150 families, and we had 19 respondents for the first one that we did in 2018. I think it is most helpful if we call them first and then tell them that, hey, this one, we have a survey, we're doing this, and explain why. We had an event, and that turnout for families for that event was better because I had to call them first and invite them through telephone instead of just sending them a form and they don't know who I am or what it's for, even though it's already on the survey what it is. Sometimes the personal connection is helpful.
This is Esther Kotwitz. I'm with Lawrence Public Schools, and the school district has started using, I think it's a program called Thought Exchange. And we recently used that as we've started a partnership and looking for partners in our community. And our Community Children's Center, which is not a center, it's just an agency that we partner with, they started a hub, which is an informative hub, maybe not so much a partnership hub yet, but as I'm listening, I'm thinking that would be the next step for this work. But that group then used the Thought Exchange just last week to get community input on the early childhood center, the needs, and we had a much better response community-wide than I would have predicted.
This is Dana Schatz, and sorry if you hear snoring in the background. My bulldog is sleeping under my feet. But at our agency, we do a couple of things, and they're very simple. But if we have, let's say, we do a triple P group of families, we always joke, if you feed them, they'll come. And so we feel very fortunate that we have some funds that we can use as far as feeding families if they come to, let's say, a lunch or a dinner or something, an hour and a half training. And we also provide daycare, and it's usually just one of our other workers, or we've used some kids from the community, high school kids. And then when we're going to collect just individual data from our families, again, we feel very fortunate that we can provide a little incentive, and that might just be a book or an educational toy that we can give the family. Sometimes it's just a $5 Sonic card. And I know families appreciate that. And we've just found that if you can give them even just a little something, or offer to buy, hey, I'm running 2 scooters, can I get you a coffee before I come over? They seem to appreciate that, and that works well for us. But yeah, feeding them is always a good idea.
At KCSL, we've used a couple different things depending on the program and what we're working towards. So we've used parent cafes, or appreciative, also called appreciative inquiry sometimes, where we really just ask pretty broad questions about how we're doing, what they would like to see improved. Those are in person. Obviously, we haven't done those in a while. Well, I shouldn't say that. I haven't talked with all of my staff to know if we've done that by Zoom during COVID, but it doesn't work quite as well. But the thought is it's brainstorming, and parents get input from, they think of more ideas as they're listening to other parents. And then with Head Start, we obviously we would do surveys, but we also do interviews with our parents to ask for input. I mean, that's kind of a very specific expectation around the community and needs assessment and identifying programming. And so we do interviews with parents.
I have a question, but I think Cora, you were going to say something. Oh, does anyone effectively do when it was more acceptable to meet in person, like an advisory council that combined both professionals and families? And if so, was there a sweet spot to the time on that?
The challenges of Head Start. So, I participate in the Head Start, Kansas Head Start calls, and I think that is a struggle that many have. I would say that the ones that probably have more success in getting the professionals there, that combined piece, that's kind of a requirement. Oh, your little one is saying hello. Have been during the day, but that doesn't always, I don't know, depends on the population you're serving for parents and whether or not they can do that. I know so KCSL has a very wide variety of programs that we have, and depending on the population that we're serving, sometimes day stuff works well because the parents that we're working with are either unemployed and working towards employment. So they have that flexibility, or they're working shift work. And so it's a hit and miss as far as when you're going to be able to meet with them anyway, a larger group of them. But then some of our programs work with parents who are adoptive parents or foster parents, and we tend to steer away from like Wednesday nights, but we either do an evening or a Saturday morning. Again, steer away from Sundays. Wednesday nights, there's a lot of church activities. Steer away from Thursdays and Fridays. Again, lots of sports activities. So, yeah.
I'll chime in on that one too. I came from a Head Start program where we would have our ICC meetings, and then we'd have our parent council meetings. So we had really good luck with doing it at lunchtime and providing lunchtime, because that way we had our food. If you feed them, they will come. But it was also for the professionals, a lot of them were on their lunch break. The families, the kiddos were already in class and eating in the program, so they didn't have to worry about childcare. And then, of course, our staff was all there too. So lunchtime worked really well, we found.
I served as the chair in Leavenworth County for the Tiny K program for 9 years, and getting parents to have the time to work. Lunch works the best, but that engagement's real difficult. But we never came up with a really good solution unless the parent was a professional in the community. And that's how we, I hate to use the words got around that, but that's how we were able to satisfy that requirement.
Thank you. That was really helpful. I just trying to get our own advisory council for my program and looking also into advocacy groups. And it's like, what if we wanted to pair the two, what's that sweet spot? So I appreciate your.
And I'll just jump in too. We have struggled with that as well. With our family advisory council, it is predominantly families. So any participants that are professionals that join, it's because they're invited guests from the council. But we do have the Kansas Maternal Child Health Council, and those meetings are like almost full days on Wednesdays. And we do have some families that serve on those, but we are limited to the families that are able to be off work and all of that. So I agree with Gail in the comment of it also depends on the population. Like most of ours are statewide groups. So it's even harder to get all the people to anything unless you're doing virtual. But if you're in a smaller community, then I agree with like the lunchtime stuff. What we found so far, what we're doing with the family leadership team is like Fridays at the lunch hour time, so that it was well, like if the families that are participating, if they work, maybe they could just do it at lunch. But then the family leaders that serve on the family leadership team are the Family Advisory Council executive committee members, and we do their executive committee meetings when it's just them on Saturdays to support them. So we're trying to do kind of a blend of when we all need to be together, we try to cater to the professional work week versus just the family needs. But then we said, okay, well, then on the other side of that, those of you that are professionals that are going to participate with the exec committee, we're going to do it on a Saturday because families are giving up their Friday at noon. So it's a give and take. So that could be an approach too, when you're trying to merge and say, if you're meeting monthly, maybe every other month is on a weeknight and the other ones are during the day. And so that way families aren't always asking to shift their world and professionals aren't always shifting. I don't know. That could be an approach to try. I don't know. We're all about trying anything once.
This is Maritas. We do meet at night with our families. I have just rearranged my time. And so they decided what time to meet at night, 7:30. It's not an ideal for me. I'm a mom too. I have a child at home. But that's where we meet. We meet at night. We also do have I don't know if this is question numbered or where it belongs on the question. We do have an event annually that we do with our families. We call it the annual family day, and that is in person. And we invite our families to plan the event. And we moved from, it used to be in Kansas City, and then we went to Topeka, and this year we're going to Wichita. So we're trying to do different regions because some families in different areas are not able to come, even though we provide for accommodations. There are other needs that we can provide. So.
I would offer up for KASDE when we're asking how we collect input from families. So speaking on behalf of school districts, I would say that input is gathered from families as they are doing their ASQ surveys and working together to get those done, as well as orientations at the beginning of the year. That's kind of where we are right now. I think that's our big input from families. We push schools to think about that during transition time as well, and think about, what's going to be as this kiddo moves up through kindergarten. What are some things that both parties need to think about?
We've got about 5 minutes left before we will go back to the group. So we do have 3 more questions like this, I think, for the sake of time. I'm just going to hold on to those for our next meeting and then jump right in. I don't want to cut anybody off. This is really good discussion, but just to give you a little preview, so you can kind of have a month to think about some of these things, is thinking about what, we talk about family partnership, family engagement, family leadership. What does that mean to you? I know with the Family Advisory Council, there was some interesting conversation about leadership can be kind of a daunting word. And what is the expectation that professionals put on that when we say come be a family leader? What kind of skills can we help families build? What kind of training is available? What are they most interested in? So thinking about things like that. Also gaps of what you're seeing either in your agency or kind of across the system or just in your own life in terms of what you'd really in your dream world, what would really effective family partnership look like? And then how do we kind of work backwards to think about, is there a recommendation that this group would like to present to the full panel? Is there some sort of step to kind of work toward that vision? And then also digging into how do programs or agencies or as a state, how can we show families that their voices are really valued and they're really being listened to? And what does that look like beyond words and in day-to-day actions? So that's one section. And then we'll get into thinking about should families be involved from day one? What does that logistically look like? When does it make sense to bring families into the conversation? How much input is can they have? I know there's an interesting tidbit in the Family Advisory Council meeting about sometimes the reality is things, either because of regulation or funding restrictions or other things like that, may not be changed. And so how can we be transparent with families about ensuring that, you know, we're reporting back on how their input is used, but also like, is there realistically a limit to that? And what does that look like? And then again, kind of the leadership and thinking about, you know, what exists across the state that is working well that we could maybe leverage and build upon. So I know that's a lot to kind of think about, and we won't come back together for a few weeks, but we can start the conversation there in September. And certainly, again, like this is a starting point. I think as we were talking, I was already hearing things of like, oh, that could be a really interesting conversation about how do we get some more resources out there. I think there's a lot of common challenges. So just kind of think about like, what do you want out of this work group? What would you like to see? You know, I don't think we need to define what our product or end goal or anything is at this point, but just kind of things to think about as we head into our next conversation.
Megan, I have a quick question.
Absolutely.
For our notes, do you want me to send those to you? Do you want me to send those to Debbie?
Would you send them to Debbie and copy me? That would be great. Thank you so much for doing that. I appreciate it. And Crystal, thank you for volunteering to report out. Do you feel good for that?
Sure. I scribbled a few things, and all of your handouts are going to be helpful.
Perfect. Well, if you need any help, just shout. You're not alone in this group. Well, thank you all. I'll give you just a couple minutes before you move back. I know it's we're kind of figuring out this jumping in out of Zoom. So thanks for bearing with us on that. And yeah, thanks for your ideas and sharing your experience today. I'm really excited to see where this group goes over the next few months.
Likewise. Thank you, everyone, for your input.
We'll see you back in the main room.